A concussion is the most common form of mild traumatic brain injury, or TBI. In this video, we're going to use the visuals from Visible Body Suite to get a closer look at the anatomy and physiology underlying concussions. We'll start off with the basics. What causes a concussion? Concussions are most often a result of falls, motor vehicle accidents, and injury during sports. Symptoms can include dizziness, headache, problems with vision or balance, or even a loss of memory or consciousness. Concussions are sometimes caused by a direct blow to the head, but can also be caused by sudden movement like whiplash or rapid acceleration or deceleration. Whatever the mechanism of injury, a concussion happens when the brain moves back and forth quickly inside the skull. It might twist, hit the side of the skull opposite the impact that caused the injury, or do that and then bounce back and hit the skull a second time. Brains are indeed fragile, but our bodies offer them pretty good day-to-day protection. So what normally protects the brain? First, we've got the skull, specifically the 8 bones that make up the neurocranium. We can examine those in 3D with the skull model. On the outside, we'll highlight the frontal, temporal, parietal, and occipital bones. Then, we'll use the dissect tool to look inside, where we can find the ethmoid and sphenoid. With the related content box, we can access the disarticulated skull animated model, which shows how the bones of the skull fit together. We can also look at transverse and sagittal sections of the skull to examine how it fits around the brain. Let's add the nervous system to our original skull model here using the systems tray. Inside the skull, the brain has 3 layers of cushioning, the meninges. You can see the outermost one, the dura mater, here. To see the others, we'll use the cerebrum and meninges cross-section. Let's tag the cerebrum and the skull. Then, we can see that there are 3 layers in between, as well as a space filled with fluid. The pia mater is the closest layer to the cerebrum. Then comes the subarachnoid space, which is filled with CSF, or cerebrospinal fluid. This fluid cushions the brain, facilitates the exchange of nutrients and waste, and allows the brain to float. Then we've got the arachnoid mater, the middle layer of the meninges, and the dura mater, the outermost layer, which actually has 2 layers of its own, one closer to the brain and one closer to the skull. So what gets injured or disrupted in the brain when you have a concussion? Much of the injury from a concussion is microscopic, meaning that even a CT scan won't always give a surefire diagnosis if you're concussed. So let's look at the neuron model to zoom in on the cells within the brain. The impact and subsequent bouncing around of the brain causes neurons to stretch, which can damage the cell membrane, as well as the axon, the long tail of the neuron, and the neurofilaments inside it. The myelin sheath protecting the axon can also be damaged. Neurons rely on ions like sodium, potassium, and calcium, and chemicals called neurotransmitters to communicate with one another. Damage to the cell membrane can disturb the balance of ions on either side of that membrane, compromising the cell's ability to function properly. But there are definitely more visible signs of trauma, especially with more severe concussions. We can visualize this using the draw tool on the cerebrum and meninges cross-section. For example, if the brain hits the skull when it bounces or twists, damage to blood vessels can cause bleeding and bruising. What's even more dangerous is brain swelling. Because there's only so much space in the skull, if the brain swells, that compression can cause blood flow to affected areas to be restricted or completely obstructed. Even if the brain doesn't swell as a result of the initial concussion-causing injury, it's important for someone with a concussion to get plenty of rest and try to prevent another injury while they're recovering. Concussions make the brain particularly vulnerable to further damage. A second concussion before the first one is healed can cause rapid brain swelling, which could be fatal. Repeated head injury over time, say a years-long career playing football, can also cause long-term damage to the brain. CTE, or chronic traumatic encephalopathy, is an example of this seen in athletes. Fortunately, the prognosis for most concussions is good. Most sports-related concussions heal within around a month with adequate rest and a gradual return to activity. And though it isn't possible to avoid head injuries completely, small precautions like wearing a helmet while playing certain sports or riding a bike, or wearing a seatbelt while driving, can help make those activities less risky. Want to learn even more about the skeletal system and nervous system in 3D? Check out Visible Body Suite at visiblebody.com/VBSuite.